Welcome to the first in a new series of video blogs from Practice Growth Agency. The series is entitled On the Sofa with Kevin, and each month we are going to choose one of our friends or partners from the dental sector to come and discuss their services more and inform you how you can help your practice to increase revenue and increase patient numbers. And in the first month, I am delighted to have a very good friend, as well as a former colleague and almost dental royalty, we could say, Janice Charlton from Patient Plan Direct. Good morning, Janice.
Hi, how are you doing?
Fantastic, and how are you?
Great, thank you. Perfect.
So I think, obviously, Patient Plan Direct, I think it makes sense that what we discuss are patient payment plans. You have worked across this sector for some time now. I guess a good place to start would be what changes you have seen in the plan sector over the last 15 to 20 years.
I think certainly over that period of time, there's been a definite swing toward practices setting up more of a membership or maintenance plan. Previously, of course, in the early 90s, mid-90s, even into the 2000s, most plan patients would have been registered onto a complete care plan. Now there's the trend is more toward a maintenance plan, whereby the patient simply pays for their examinations, their hygiene, some small x-rays, and perhaps then a built-in discount for a discount off routine dental treatment.
And over that period, as you've said, you've seen all of those changes. In terms of the practice, it strikes me that certainly practices want to solidify their own brand within a plan rather than perhaps a national brand of certain other providers.
I think it's important for any practice to develop their own brand and to strengthen their brand and almost to cement the relationship between the patient and the practice. And a fantastic way, of course, to do that is to do that via a practice-branded dental plan. So it almost becomes a membership whereby the patient feels and you're attracting the patient to become a member of your practice rather than a member of a national brand. Why not focus on your own brand and develop your own brand?
And what would you say are the main benefits to the practice of having a dental payment plan?
Oh gosh, there is so many. God, I could spend so many minutes talking about this. But I think that the main advantage, of course, has to be having patients on a plan develops that nice, steady income stream into the practice. So you know every month you've got a guaranteed income that will drop into your account on the given day. It gives you a dedicated cohort of patients that you know are members of the plan and therefore more likely to attend regularly for treatment, more likely to attend more regularly to see the hygienist, less failed appointments, encourages the patient to spread the cost of their care, and really, as I've said before, just helps cement the relationship with the patient.
So those are some of the benefits for the practice. For
Definitely.
a patient, what would be the benefits of being on a dental plan?
Oh gosh, I can really speak from the heart now as a plan patient myself. It's obvious that you can spread the cost of your care over the months, so there's no unexpected bill when you get to the practice. It certainly encourages me to attend for my routine exams and pre-book examination and hygiene appointments. I always feel reassured and I've got that peace of mind of the additional insurance cover. For someone like myself who is often working away from home, the insurance cover is invaluable. If ever I have a spot of trouble, I'm covered for dental emergencies. God forbid any accidents that resulted in damage to the teeth can be covered. So in general, I think it's just a fantastic way to keep your patients dentally healthy and to keep encouraging them to come back and see you regularly.
Okay, so I'm sold, I want a dental plan, it's going to be great for the practice, it's going to lock in revenue, it's going to be
Good
great
stuff.
for the patients,
Yeah.
the future's amazing. That's all fantastic for new plan launches, but say for example I already have a plan in place, and I appreciate that that the majority of plans are infinitely more expensive than with Patient Plan Direct, but what would be the main advantages of going specifically with Patient Plan Direct over any other plan provider?
I think It's a really interesting question. I've worked with other plan providers in the past. The main and the most significant difference is Patient Plan Direct, I think, have found a dental plan solution to take us well into the 21st century, meaning that everything is online in the sense of online registrations. Your patients can register straight on, even from the comfort of their own home. The portal facility we set up for practices allows practices to have 24/7 live time reporting. So you're not dependent on calling a call centre to check the status of a patient. If you want to know if a particular patient is registered and paid, you simply log on, click in, and the information is at your fingertips 24/7. And of course, I suppose I have to mention, and I should mention, our processing, our admin and insurance cost is just simply £1 per patient per month, which means the dentist retains a higher proportion of the plan income, meaning more profit.
Excellent. Thank you very much indeed. So there you have it. Dental payment plans, fantastic for the practice, fantastic for patients, and a great way to get to meet Janice in your practice. Thank you very much for being the first guest on the sofa. It's almost lunchtime, so I think we can retire for a bottle of Prosecco to celebrate the first one of these, and we look forward to doing them more often over the coming months.
Wonderful, thank you. Thanks.